My name is Jessica King, and this is my Capstone project for my senior project class. I'm here with a few of my coworkers at work to discuss pressure ulcer prevention. Okay, so the purpose of this PowerPoint today is to discuss pressure ulcers. We all know that pressure ulcers can be a terrible thing for patients to obtain, especially in a hospital setting. And this project discusses ways to decrease the risk of pressure ulcers. This topic is important because pressure ulcers can be painful, they can increase the length of stay of patients in the hospital, and can increase the risk for actual infection in patients. And hospitals do not receive any type reimbursement now from Medicaid or Medicare for pressure ulcers that are acquired in a hospital setting. So, my suggestion for improvement is to place SOS signs on the doors of all patients that are deemed high risk for pressure ulcers. And the SOS stands for Save Our Skin. Also, with that, we are wanting to implement a musical reminder system. What would happen with that is music would be played over the monitor, overhead, over the loudspeaker every 2 hours to remind staff to turn any patients that have the SOS sign on their door. And once again, the goal of this presentation is to educate the staff on ways to decrease the number of pressure ulcers. First of all, the first step to preventing pressure ulcers is identifying who is at high risk for getting a pressure ulcer. And we do that here in our facility by using the Braden scale. Patients that are identified as high risk would need to have the SOS sign placed on their door and be turned at least every 2 hours, some maybe more, depending on their comorbidities. Specific staff reminders have been shown to decrease the number of pressure ulcers. Sometimes staff get busy and it's hard to remember that you need to turn these people that are at high risk for pressure ulcers. So if we have some kind of reminder, we tend to do a better job at turning our patients. Pressure ulcers are very difficult and costly to treat. Stage 3 or stage 4 pressure ulcer can cost $5,000 to $50,000 to treat. And pressure ulcers are actually becoming more common in hospitalized patients. In 2006, the number of hospitalized acquired pressure ulcers increased by 80%. And that's a staggering statistic. I mean, that's a lot of people with pressure ulcers. In 2009, the incidence of facility-acquired pressure ulcers was 5% based on all patients in the hospital. And since the Centers for Medicare and Medicaid have decided not to reimburse hospital-acquired pressure ulcers, this is forcing hospitals across the nation to change what we're doing to prevent these pressure ulcers. Performing frequent turning on these high-risk patients will decrease these numbers of pressure ulcers. Patients benefit from this change. Pressure ulcers can lead to life-threatening illnesses, infections, increased mortality rates, and longer hospital stays. Turning the patients every 2 hours has shown to decrease these numbers of pressure ulcers. Hospitals will also benefit from preventing pressure ulcers. Shorter hospital stays and decreased mortality rates are beneficial for hospitals. Since we're not getting reimbursed for these pressure ulcers anymore, the hospitals are eating the cost of patients who are developing pressure ulcers here. So my PICO question is, in the immobile hospitalized patient, will the use of musical reminders decrease the number of pressure ulcers more than turn schedules alone within 1 year? A recent 12-month study conducted using the musical reminders to turn patients showed that patients in hospitals that used the musical cues were 45% less likely to develop pressure ulcers than those in facilities that did not use reminders. This trial was a randomized controlled trial with almost 2,000 participants, and it was performed at 10 different facilities. Recommendations for change would be that the hospital staff would need to be re-educated about the use of the SOS signs along with how to determine if somebody is actually high risk for pressure ulcers. The wound care nurses here at our facility will be good people to teach this to the staff members. And nurses must be educated to actually put the signs on the door when the patient is deemed high risk. In order for this change to occur, SOS signs must be readily available. The music that we're going to use to remind people must be chosen and given to the proper people who play it over the loudspeakers. And the procedure must be explained to all the staff involved, CNAs, nurses, anyone involved with joining the patient. Staff must be educated and monitored while implementing this change to make sure that they're doing it correctly. The charge nurse or the manager of the unit may be responsible for monitoring everyone to make sure the change is actually done. Rewards will be given to staff that comply with the proposed change. And the number of pressure ulcers that occur in the hospital should decrease over time. We would check this data by making it a PI project to see how many patients actually acquire pressure ulcers during the 1 year. And we would compare those to the prior year to determine if this is decreasing the number of pressure ulcers. The expected outcomes would be that we would have a decrease in pressure ulcers within the year. In conclusion, just to wrap it all up, all patients admitted to the unit need to be properly assessed for developing pressure ulcers. Patients that are high risk would have an SOS sign placed on their door. Music would be played over the loudspeaker every 2 hours to remind staff to turn patients. And the number of pressure ulcers in our facility will decrease over the next year. And that's it. Thank you very much.
Very good. Great job.
Great job.
Thanks.